Hello, my name's Joanna Martindale and I'm the Chief Executive of the Hangleton and Knoll Project. We're a community-led charity based in the west of the city, and this year we celebrate our 40th birthday. We work with everyone in the community of all ages, from 0 to 90 or more, and target our work with all the various diverse communities, whether that's working in partnership to support parent carers, or with our multicultural women's group, or with our youth work offer. One of the pieces of work that we've been developing over the last 8 years is a partnership with our primary care colleagues, and that's the West Area Health Forum. This came about initially because Hangleton Manor, which was a GP practice in our area, was scheduled to close. And at that time, there were no patient participation groups in any of the surgeries on our patch. And together with what was then the CCG, we were supported to set up a health forum. And the health forum was set up with the idea that we as a community could come together with primary care colleagues, discuss the problems, and together come up with solutions. So every quarter, 40 odd people come together. All the practices are represented by their practice managers, our PCN by our clinical director and PCN manager, and loads of other stakeholders within health, like the community pharmacists, public health colleagues, with patients and residents from all practices. People that come along that aren't there for a job have over time developed a health champion role, and we have health champions now representing all our forum in all sorts of other places. So we have a Portslade patient who works with me on the Primary Care Network governing body. We have someone from Links Road Surgery who until recently chaired the PPG network for the city. But we also have health champions that are access points into their various diverse communities that we serve. We have Snay, who represents the multicultural women's group and reports in and back from there. And we have people like Pat and Mary, who are just very well linked in with their communities and have particular interests in certain conditions, and also in representing people who might not come to the meetings point of view. That informal volunteer role takes the message of the forum out and brings intelligence back in. And there's around 15 to 20 people who would call themselves a Health Forum Health Champ, and who come together outside the formal meetings to decide what's on the agenda, what our priorities are, and how we move forward as a group. At the heart, the Health Forum is a resident-led patient group. We don't allow anyone to bring PowerPoint. We don't allow anything other than plain English. People are allowed to ask whatever questions they like. And this format has produced some really strong partnerships that have meant that we don't just talk, that we've taken action. We've run projects around supporting women through their menopause. This was raised by a woman within the forum meeting, and now we have peer support every couple of months, supported by Dr. Zoe Shadell. Diabetes care, we know from our data that we have high incidence of diabetes and increasing diagnosis of diabetes. So we piloted with Benfield Surgery some workshops within the community looking at healthy eating and better management of blood sugars. That was really successful, and we're taking that forward this year with Mile Oak Surgery, who are looking to pioneer with us how group consultations could work with them with a community focus. I think our vision for the next year is very much to think how we create those pathways between primary care and the community offer, supported by our social prescribing colleagues in Together Co, so that people really do have the opportunity to think about how they can be supported to make the changes that they need. We're a community that isn't very wealthy. We're quite geographically isolated. The facilities and services that are available to people tend to be run in the community, and that makes them free and low cost and accessible, and gives people a real chance of being able to make the changes that they need to make themselves and their families healthier.